Hey everyone, welcome back to my space. Today I will be talking about a serious but important topic: how lethal injection works. As of last week, Imam Marcellus Williams was executed by lethal injection for a crime he didn't commit. May Allah be pleased with his soul and accept his return. How does this lethal injection work? I will explain this in a very simpler term so that you can easily understand. And at the same time, I will relate these drugs to what we use in the healthcare. As a nurse, I see some of these medications, but for very different reasons. So I will tell you how this injection works in the case of execution and how this injection works in the case of clinical practice. So what is lethal injection? It is simply injecting drugs into the body in order to stop the function of the vital organs in the body. This process uses a combination of three drugs: one, the pentobarbital; two, the pancuronium bromide; and three, the potassium chloride. For the pentobarbital, in clinical settings, these drugs are usually used as an anesthetics, or you call it sedatives. They are used to help patients safely go through surgery. Any patient that is going for surgery, they are given these as a sedative so that they don't feel the pain of surgery. And also, they are used to manage a severe seizure in those cases. But mind you, the doses we use are controlled in order to ensure safety. And for the second one, which is pancuronium bromide, these medications are usually given in order to relax muscles during surgery. It is also used in intensive care when a patient is on a ventilator. It is carefully monitored by healthcare professionals in order to avoid any form of complications. For the third one, which is potassium chloride, in small, carefully measured doses, potassium chloride are usually given to patients who have low potassium levels, which can cause dangerous heart rhythm. However, in large doses, it can be fatal by stopping the heart, which is why it is used in lethal injections. Overall, you can see how valuable these medications are used in healthcare system. Now, over to the execution. For execution purpose, how are these drugs used? Let's take it step by step. Step 1, the person is strapped to a gunny and an IV line is inserted into their arms. Step 2, the first drug, which is the sedative pentobarbital, will be given through the IV line. This makes the person unconscious, usually within 30 seconds to a minute. It is supposed to make the person feel no pain of execution. Step 3, the second drug, which is the pancuronium bromide, is given. This causes all the muscles in the body to become paralyzed. This stops the person from moving, speaking, or even breathing. Step 4, finally, the potassium chloride is injected. Once this drug reaches the heart, it causes the heart to stop beating, leading to death within minutes. In total, the process usually takes around 10 to 15 minutes. So in the case of healthcare, these injections are being given in a controlled manner, they are well measured and given in smaller doses. But in the case of execution, they are given in large doses and they are not even controlled. That is what fastens its actions in causing death. There's something I learned about this method of execution, that lethal injection is a kind option of execution. What do you think about it? Do you think this is a kind option of execution? As a matter of fact, there have been critics about this injection because it is not that the person will totally not feel any pain in every cases. There have been cases where people were conscious but unable to move because of the paralytic agent, meaning that they might have felt pain from the potassium chloride effect on the heart. Another concern is about wrongful executions, like in the case of Imam Marcellus Williams, where DNA evidence didn't conclusively link him to the crime. For those against the death penalty, mistakes like these make the whole process unjust. So from your own point of view, do you think this is truly a kind option of execution and a just way to punish somebody? And should these still be used? Let me know in the comment section. Thank you for watching, and I hope you get a clearer understanding of how lethal injection works. I remain Kafayat Kemisola, a Nigerian registered nurse, and I hope to see you in the next video. Bye.